Hello students, today I will explain the why do we fall ill chapter, and this is class ninth, chapter 13. So today we will discuss about why do we fall ill. So student, as you know that in this chapter we will discuss about the health, disease, sources of disease, that is your health, disease, sources of disease, types of disease, mode of transmission of disease, symptoms and signs, and prevention of the disease, that is vaccination and immunization we will cover. And after that the question answer of this chapter we will discuss. Okay, so let's start the first of all, health. What is health? You know that according to the WHO, your health definition is it is a state of physical, mental, and social well being. Means that you are physically, mentally, and socially fit. Physically means your appearance. If anyone see you, then they can say you are healthy or not. And if we talk about the mental level, then if you mentally fit, then you healthy. And social well-being is also a good factor of your health. Means that you are not taking smoke, you are not doing smoke, or you are not taking alcohol. So socially you will be fit, you should be fit. Okay, it is a state. Now it is a state of physical, mental, and social well-being. So this is the definition of your health. Your health will be good if you are physically, mentally, and socially fit. Okay, after this, you know that for being healthy, one need to eat a balanced diet. We know that balanced diet is very essential for your health. So balanced diet means in how many quantity or amount you have to take uh, pulses, you have to take milk, or you have to take protein, carbohydrate we can say, and take rest. So rest is also a good factor of your health. And take proper sleep. So you can sleep 6 to 7 hours, or we can say that 6 to 8 hours per day. In between these hours, okay, live in a hygienic place. So hygiene means cleanliness is very important. So if you want to be healthy, then you have to take balanced diet, you have to take rest, proper sleep, and you have to live in a hygienic place. But sometimes certain signs appear in a person that causes uneasiness, means uncomfortable. This uneasiness is called disease. Means that if you see in a picture, in this picture, this is the girls, beautiful girls you can say, and in this diagram, these girls suffer from the disease. Means her eyes are protruded, she have some wrinkle on their skin and some rashes on their skin. So you can easily say that this girl is suffering from a disease. Okay, so know about let's know about the disease. So, my dear students, disease is a state when the body is not functioning properly due to one or more reason. If your body have any discomfort, we can say your body has any discomfort, or we can say any disturbance, discomfort. Okay, and any disturbance in your body parts or any organs. So we can say that you are suffering from a disease. So dear students, if your body, or we can say that it is a state in which your body have any discomfort or any disturbance of any part of the body or any organ of the body, so this is called disease. Health is also influenced by many factors, you know that community factor and personal hygiene. So community factor and personal hygiene is play an important role for build up your health. So as we know that we live in a society, so our social environment also play a key role. Like, first of all, we should keep our houses clean. Proper sewage disposal should be there. No stagnant water, because you know that there are many kinds of diseases which are spread through the mosquitoes. So mosquito lives in stagnant water and causes malaria, you know, dengue, you know. Okay, no open drains. There will be no open drain also. Similarly, personal hygiene is personal hygiene is also important. Like, one should take bath regularly. You have to take bath regularly and you have to wear clean clothes. Okay, proper brushing of your teeth. Okay, you can see in picture proper brushing of your teeth twice or thrice in a day. Drink clean water. You have to take, or you have to drink clean water. Eat adequate nutritious food, means we can say you have to take balanced diet. One should maintain social harmony and equality. So this is also a main and important factor to maintain social harmony and equality in between your neighbors. Sources of diseases. So dear students, you know that there are are two sources, intrinsic and extrinsic. Okay, intrinsic factors means the disease which are inside the body. The disease is present inside the body, are sources which are present inside the body. And extrinsic means outside of the body. We can say that outside of the body, sources of disease present outside of the body. Okay, so let's start with intrinsic factor. What is intrinsic factor? So they are the factor that are within the human body, means this type of factor arises from human body, inside the human body. Now you can see in picture, this is the what? Yes, goiter. You know that this is the goiter, and this one is the arthritis. So goiter is intrinsic disease. Okay, causes by intrinsic factor, and goiter is also caused by intrinsic factor. Okay, these diseases are caused by internal factor, or we can say that intrinsic factor. Therefore, they are also called organic diseases and can occur due to any of the following reason. Means that this goiter and this arthritis is caused by the following reason. First of all, malfunctioning of any body part, means deficiency of any body part, means they are not getting proper or adequate amount of food or balanced diet. Genetic disorder means that this disease comes from the comes from their parents. Hormonal imbalance due to the imbalance of the hormone. Malfunctioning of immune system. If your immune system is not working properly, then you will suffer from these kinds of disease also. So dear student, disease caused by improper secretion of hormones. If you discuss about the hormone, then you know that disturbance of hormone causes goiter, diabetes. You know that this maintain your sugar level, and if the concentration of insulin is lower, then diabetes mellitus causes. Okay, cretinism, goiter is held in adult and cretinism is held in children's. Okay, so this is the cretinism. This sign or this diagram is the cretinism, related to the cretinism. Stunted growth of the brain, or we can say that body. Okay, and last one is Addison disease. So goiter, diabetes, cretinism, Addison disease, these are the diseases caused by improper secretion of hormones or imbalance of the hormone, due to the imbalance of the hormone. Classification of the disease: physical. What is the physical? Bone fracture. Leprosy is the physical factor. Infectious as typhoid, AIDS, malaria, etc. So this you can see, this is the scurvy, and this is due to the deficiency of vitamin C. Okay, this pigeon like ribs bone is due to the malfunctioning of the protein and carbohydrate. This is the marasmus disease. Okay, and this one is your this diagram is your leprosy diagram. Okay, in which you can see how the hands and fingers. Okay, deficiency as scurvy, marasmus, kwashiorkor, etc. This is deficiency diseases. Scurvy you can see in the gums, deficiency of vitamin C, marasmus. This is the marasmus and kwashiorkor. Okay, inherited means sickle cell anemia. Means sickle. What is sickle cell anemia? You know that your RBC is just like this, disc shaped, and this helps in the transportation of oxygen. Okay, if your RBC sickle shaped, means sickle shaped like this, so the transportation of oxygen is deficient into your body, because this diameter is more much and this is not. Due to this, the transportation of oxygen is not proper. Next is degenerative as poor sight, poor hearing. This is the degenerative diseases. Mental as you have suffered from depression, social as drug addiction, etc. So these are the kinds of diseases. Okay, different type of diseases flow chart. If we discuss, then you know that there are two types of diseases: communicable diseases, non-communicable diseases. Okay, communicable means they can the diseases are transferred from the sick person to a healthy person, and in the non-communicable diseases, the diseases are not transferred, like kidney failure. If anyone suffer from the kidney failure, then there will be no any chance of transfer one person to another person. We can say that from sick person to a healthy person. Okay, and after that there are two types on the basis of the duration of the time, acute diseases and chronic diseases. Let's discuss about it. Communicable diseases. Dear students, you know that those diseases that can be spread from a sick person to a healthy person through contact. Okay, these kinds of diseases is spread through a sick person to a healthy person through contact. They are mostly caused by external factors, means intrinsic factors. You can see the diagram. This is the diagram of tuberculosis, or we can say that this is the pneumonia. Okay, they are transmitted through direct contact or through air water vectors. So dear students, you know that three factors involved in the spreading of disease: air, water and vector. And most common air, water, food also. Okay, and sexual transmitted diseases also, they can also involved. They are also called infectious diseases. So communicable diseases are also called the infectious diseases. For example, cold, common cold, cholera, tuberculosis, pneumonia, malaria, these are the infectious diseases. Means that it can spread from a sick person to a healthy person. To a healthy person. These diseases are mainly spread through pathogens, pathogen disease causing agent, and the mode of transmission is either of the following: air, water, vector and sexual contact, as I discussed it earlier. Next one is airborne diseases. Those diseases that are passed by the air are called airborne diseases. Means air is responsible for spreading of diseases. They are transferred by droplet infection. You can see in picture the person is coughing and are sneezing, we can say. There are mainly a lot of droplets are releases into the atmosphere. Okay, so these are the droplet infection. For example, if any person having cold sneezes, then he releases the droplets in air. You can see these are the many droplets which are releases in air. The same air is inhaled by the infected person who passes the disease causing agent to a healthy persons. Okay, so you can know sick person is responsible for transmission of diseases into the healthy person. Example, cold and cough. Waterborne diseases means dirty water or water responsible for spreading of diseases, then they call the waterborne diseases. For example, if a stool of any sick person passes into water bodies and that water is not purified and by any chance it mixes with the drinking water, so this is the waterborne diseases. If a stool of any sick person passes and it mixes with the water bodies and that water is taken by any healthy persons, so they can suffer from the disease. This water, when taken, causes infections like cholera. Cholera is waterborne disease. Sexually transmitted disease, they are caused due to the any of the following reason. Means they are sexually based, sexually contact based diseases, and due to the using of the same syringe it can spread. Example, syphilis, AIDS, etc. So it can be transferred through sexual contact or blood transfusion. Okay, so majorly sexual transmitted disease is held due to sexual contacts. Vector borne diseases, Vector are those agents that transfer the diseases causing agent to us. Vector is the medium which transfer the diseases, okay, which transfer the disease. Like mosquito. Mosquito saliva have plasmodium, and when it bite any person, these plasmodium is mixes with blood, means this saliva is mixes with blood, and saliva contains plasmodium, okay, then it mixes with the blood and causes malaria. And you know that female anopheles mosquito is responsible for the transmission of the plasmodium in its saliva, means female anopheles is responsible for the malaria disease, and the pathogens plasmodium present in its saliva. Due to this, the pathogen is transferred to us. So, in case of any malarial or malaria, vector is female mosquito and the pathogen is plasmodium. So, plasmodium is the causative agent of the malaria, of the disease. So, dear students, in next lecture we will start the communicable diseases, okay, non communicable diseases.